Okay. Hello there. Good afternoon, good morning, good evening. Wherever it is you're joining us from, thank you so much. And a lovely weekend to you. This is Living LTV Live with me, Dr. Gbenga Adebayo. And we are here today to do and ask me anything. Ask me anything. Yes, you can ask me whatsoever you desire. Be careful what you ask, but yes, so we're asking anything else. And I usually enjoy this session because it is usually rich. People ask different questions. We're able to touch on a lot of different things. It is the time of joining us. Thank you so much for taking time to join us today. My name is Gbenga Adebayo, and we usually have a lot of fun on this program every time, every Friday, as we have opportunity to do it. So today we are going to do, like I said, an AMA. We want to ask anything. I want to please encourage you. If this is your first time. Please like this channel, share this video with your friends and your loved ones, and let's go right ahead to share it. So I'm going to just share this and let friends and people we are live, right? So let me go ahead and do that right now. Alive, yes, we're live. Okay, and we are live. So, um, let's go. We have a lot of welcome, Michael. Thank you for joining us. So please like, share, let people know we are live. Put it in your Facebook status, news feeds. Let friends know that we are live. So we're going to just take questions. If you have any question, any issue, now on your mind, not necessarily bother you, something on your mind for you, for friends, please let's go right ahead and ask. So we have some questions lined up, teed up for us to answer. So I'll just get my associate uh, there to just. Okay, so that's the first question. It's okay. I keep getting yeast infections. What could be the cause? So I imagine that the yeast questions we're talking, the yeast infections that we're talking about, refer to candida. So that's yeast infections of the female genital tract, right? So what could be the cause? Well, yeast infections by themselves are usually quite, yeah, they don't go easy. The thing they add to, because they can be reoccurrence. The chances of reoccurrence are high. But if treatment is properly done, yeah, we can have a good chance of total resolution. And treatment properly done means also your partner getting treated, right? Your partner getting treated. So it's not enough for you to treat yourself. You also need to get your partner. That's assuming you are sexually active. Get your partner treated. And if you are not sexually active and you keep getting repeated infections, it may mean that you are not properly treating. So as soon as you start treating and you don't have symptoms, it doesn't mean that you have cleared the yeast infection. What some people would do is to just stop their treatment at that time. So, oh, I'm no longer itchy, or I no longer have a discharge. I no longer itchy or no longer have a discharge does not necessarily mean that the infection has been cleared. It means that the treatment is working. Now you need to finish the course of that treatment to ensure that you clear the infection true and true, right? So that's how. So it's not toilet per se. People keep talking about toilet disease and what have you. So that's what could be. So our advice that you go see your physician. Let's even be sure, because let's be sure that you actually have yeast. That what you are treating is actually yeast, so that your your diagnosis, because I don't know who gave you a diagnosis, that your diagnosis is correct. So let's do swab and culture and say, yes, we have, this is infection that is responding to A, B, C, and then we treat as it should be, right? Thank you. I hope that is clear. Next question, please. If I can't clean my hair with cotton buds, how do I get rid of excess hair wax? Who told you you have excess hair wax, right? You don't. No, we have a video, and it's one of our popular videos on the channel about wax impaction, one of our area doctor videos. I'd advise that, I'll please ask that my colleague get that link and put it in the chat section. Your ears are programmed to clean themselves, right? Right? And so when you take cotton bud and you start to put it in, you actually arming that natural process, and you may actually be pushing wax deeper, 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 deeper in until you have wax impaction or you have air infections or all kinds of funny stuff can happen. So please don't put cotton buds into your ear to say you have too much wax. That's not likely. The wax there does a fantastic job. It's there for a reason. It helps to protect your ears. It helps to keep it clean, keep it dry, moist, just keep it in the right balance. So if you start to, oh, I know it's for many people it's a delicious feeling, right? To put that there, you are enjoying it, you're enjoying it. No, 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 no. So you're not doing that. If, however, you have itchy, reactive ear, the best you can do is to press here and just what we call the tragus and just but leave the wax there, leave it be. If truly, truly, you now truly have too much wax, then you can get it professionally cleaned, right? Professionally cleaned. So you go see uh, your care provider and they do it professionally, right? And your physician will tell you that your ENT or your physician, your primary care giver, will tell you that yes, we need so that's that video. This habit can make you go deaf, and truly it can. So please, no the air wax, and so people use all kinds of things: pencil, biro cover, pen cover, paper, matchstick, all kinds of things. They just stick into their ears. You are not doing well, right? So if they've told you, if they've not told you before, here I am telling you, you are not doing well. So please, nothing into your ears. Let's protect our ears, right? Let's watch that video at your spare time. Yeah, area doctor, na area level, we use that one. Or I can't remember whether na area level or na health 101, but it will help you, right? Thank you. Next question, please. If you have questions, because this is an AMA, just drop your questions in the, or if I'm saying something and you need to clarify, you don't understand it, just drop it in the chat section, right? Drop it in the chat section. Thank you. Next question. What are the most common health concerns for people who are 40 years and above? Why? Most common. It would be difficult for me to group and say these are, but we know, of course, some, especially chronic diseases, get the the chances of getting them get higher as you go older. We're worried about cancer, which is the leading cause of death globally now. Heart disease for us in this environment, hypertension, very, very serious cause of morbidity. That's illness and mortality. That's death. So when you have morbidity, mortality, morbidity, falling sick, people sick, and then mortality, which is the end point. Whether you are sick or you're not sick, everybody one day is going to die. But of course, we just want us to live healthy for as long as possible and be able to do the things that we need to do for as long as we need to do them. But one day everybody is going to die. But we want to die well. You don't want to die before your time. You don't want to die prematurely. And you don't want to live sick for an extended period of time before. I know some people are saying that maybe we don't really have to, we can live as long, we can break the chain. A lot of research going on. Somebody read recently, somebody spending $2 million dollars every year so that he can become 18 again. He's in his 40s, right? It's mid 40s, but he has a strict regime of drugs, medicines, exercise, diet. He's on a vegan diet, those all kinds of things. And they said, okay, he's getting younger, that his heart is younger than his fantastic. So maybe we're pushing the envelope and seeing how long we can live healthy. So I'm looking forward to the future. I'm excited about the future. However, as you get over 40, um, if you don't have $2 million, um, you can still help yourself, right? You can still do a lot of things to help yourself. And so we're worried about heart disease, we're worried about cancer, we're worried generally about chronic illnesses. So take care of yourself, go for your checks, right? All the things that we've spoken about and we speak about on the show here, take them seriously. Make sure that you are not just eating anyhow, right? You're resting adequately, you're exercising, you have the right amount of physical activity. All these are critical for you to maintain your health and your well-being, right? I hope that's clear. Fantastic. Thank you. Okay. Next question, please. I want us to take as many questions as possible. Remember, please ask your question. Ask your question. What is gut health and how can I improve my gut health? Interesting question. Interesting question. Okay, so in recent, we now know that, and I believe you're aware that you have more bacteria in your body, living on and in your body than your human cells. The manifold. You see, you have a lot of things, microbiome. Yeah? So you have your own gut bacteria. You have the germs on your skin, lots of germs that live in your nostril, right, in your gut, in your intestine, tons, right? If I can use that word, so much microbiome, so much, um, so many organisms that call your gut home. Now, the important thing is that we now come to realize that a balance, these germs actually do a great job. They are fantastic. They are good. That's why we say that the best soap for you to use to have your bath is what? Is toilet soap. We don't want you to use medicated soap that kills 99.999% of germs. No, 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 no. We don't want that. We want those germs that are doing good, that are protecting you from more harmful germs to stay on your skin. Because if you wipe them away with medicated soap, what you are going to do is to give room, yeah, for more dangerous stuff to come to live on your skin, and then you have all kinds of skin reactions and all kinds of funny stuff. So likewise is in your gut. You have a lot of bacteria that are there. They are helping you digest your food. They're helping you boost your immunity. And it's important to take care of those. And so some people talk about some food, some type of yogurt, probiotics, and stuff like that, that you should use them to boost or some people when they have some illnesses, what is done as one of the treatment option is for them to take a little bit of somebody's microbiome. So they might take a little bit of poop, so to speak, so that they can seed it into their gut and grow that microorganism to protect them from some of these diseases that they have. So, but the important thing is for you to realize, so what does that mean for you and I, right? Is please avoid antibiotic abuse, right? I think that's where I would like to take it to. Avoid antibiotic abuse. Don't just keep taking all kinds of antibiotics. Something is wrong with you. I met someone recently, educated fellow, this thing, she said she's stooling, and the next thing is to go and take an antibiotic. I won't mention the name. Some of people on that, some people on the call may be on that table. You know the antibiotic. Once you are stooling through like this, you just take it. Take 1 or 2 tablets. So that no, you may be harming your microbiome, right? You may be disrupting that protective factor and killing these germs that are there to protect you. So please eat healthy, avoid antibiotic abuse, and we'll be the better for it, right? Okay, Julian, welcome. So you have a question. He says, good afternoon, Doc. When children don't eat, is it normal or a sign of a eating disorder? I keep getting this question everywhere I go. It's rare for me to have an extended Q&A, and there'll be mothers in that place, and there will not be something about a child that does not eat. So the thing to know is that first, there's no child that does not eat, right? Anybody that does not eat will die. That's just the reality of the matter. So the question now is that person eating as much or in adequate quantity as that person needs? Or often what I see is that mothers want their children to eat as they want to satisfy them. Right? I remember a friend that had a picky had a picky daughter. The daughter will not eat, according to them. In fact, she will only not eat. She will eat only a particular thing. She was transiting from um, infant formula feeds. They gave her infant formula feeds, that food in quotes. They gave her all these, I don't want to mention brand names, serious, all these branded this thing. And she was using that. That's all she was eating. And then she would insist on only a particular brand, in fact, of that information. And the father was perplexed. He came to meet me. This child is not eating. This child is not eating. So he said, what do I do? I said, just leave her. Right? If how can you leave a child that does not eat? I said because there is no hunger. And you must also realize sometimes children use meal time. Is one of the ways they demand for attention. They may want you to pay attention and give them focus. I should just leave her, let her get really hungry. You see, hunger is it's a problem that the only medicine is food. This was me speaking as a parent, not necessarily as a physician. So so he tried that. They just left her alone. She became really hungry, really hungry. Guess what was happening? When the mother, by the time it was evening, when the mother was now the one drinking gari, gari is cassava flakes, milled cassava for those of us who are international audience. The girl was fighting for the spoon to eat it. So I've had the same issue in my home. Sometimes my wife used to complain that my children are not eating. They are not. I said, yeah, because I see the kids, they eat. They may not eat the quantity that you want to eat, but they eat. It might be some children are picky. They may want to eat. Eating for them may be a major event. Give that child a calorie dense meal. Be sensitive to what the child wants. Some people may like their food mashed. Some people may like it not stand alone. They may like noodles. Let me not use the brand name. They may like plantain, mashed potatoes. Just be sensitive to what that child needs and make eating, when it's family time to eat, make it a fun time together. Make it something that you all do together. Everybody's enjoying. Oh, see, mommy is eating, daddy is eating, everybody has done it. And then make it fun. But if you start to force a child to eat and you put all kinds of attention, you may be reinforcing a negative pattern of behavior that the child feels every time it's to eat, everybody focuses attention on me, and then they may actually come to expect that attention, and that may not be a good thing. They are fussy eaters. Fussy eating can be addressed, but everybody gets hungry, and if you don't eat hunger sets in, and the only solution to hunger is food. Is food. So I might need to get more. Eating disorders are not something that we just diagnose as growth. If we have more information about uh, I assume it's a baby girl now because she says she's not. Let's find out what is happening. And if a child is not eating, that has been eating before, maybe that the child is ill, right? Illnesses will not. One of the body's defenses when we are sick is to reject food because go into a fasting mode. Um, it's thought that that may help us to heal faster and mobilize resources. That's why you have loss of appetite as almost one of the symptoms of all illnesses, right? So let's find out why that child is not eating. If it's just for a picky eater, a fussy eater, or just a behavioral, then that can be handled and it can be handled well. But I know a lot of people, a lot of mothers worry about children not eating. And of a truth, there's none of my kids that at one time or the other, my wife did not worry that they were not eating. But now they have fantastic appetites, right? Maybe too much of an appetite. Okay, great. Next question, please. Next question. Are there any supplements or vitamins people should take for optimal health? This is also a rather common question. I think we've addressed it several times on the show. What I food good a good balanced nutritional approach is the best for health. In fact, a lot of the supplement industry that people get born with is not good for health. Of a good thing, supplement vitamins, micronutrients are fantastic. They are great, but they are best taken with a balanced diet, right? A complete diet. You should not be on a supplement long term without it being given to you, prescribed to you by your doctor. We know some people that should be on supplements. Pregnant women need to be on supplements. A woman, in fact, we say that everyone that is planning to have a baby, looking to have a baby, about to have a baby, should just be on folic acid. We help to prevent neural tube defects to come have a baby that doesn't have that lacks and have some deformities and things like that. And so those things are important. But having said that, so because somebody just hear folic acid now, just a middle-aged man, elderly person that is not looking to have a baby, just goes and starts to take folic acid. That's dangerous, really, really dangerous. So folic acid that is good for somebody that's a nursing mother, somebody that is pregnant, nursing, somebody that is getting pregnant, wants to get pregnant, is expecting a baby. It's not the same thing as a 50-year-old woman taking folic acid. That's calling for danger, man. That's dangerous. So you should not be on any supplement without your physician say so. So talk to your physician. All the supplement industry that take this for long life, take this for this, take this for that. I'd advise that we please be very, very, very careful. There can be too much of a good thing, and these supplements can harm you. All right, they can harm you. So please don't be on any supplement without your physician say so. Feed, eat well, and you'll be the better for it. Smelly feet make feet they smell. Is it a health issue? Well, yeah, it can be. It's an hygiene issue. Anything that affects your health is not just illness, sickness. If you have smelly feet and friends, people around you, they may run away from you. You may make your partner, if you have a partner, to be uncomfortable and people around you in the office. It can become a social stigma issue. So we need to find out why your feet are smelly. Is it hygiene? Do you keep your feet dry? Because if your feet are not dry, if your interwebs, the spaces between your toes, if they're always wet and moldy, you can even promote the growth of germs, fungi, and have infections and have all kinds of stuff. So a smelling feet is it's bad for social reasons, it's bad for hygiene reasons, and maybe a problem. So it's a health, it's a health issue, because anything that falls under your well-being, your mental well-being, your social acceptability, certainly is a health issue. Thank you, BG, for asking. When is it too much? Like, when is it a problem? Once it starts to affect you and affect people around you, then that's a problem. If you start to affect your going out, affect your relating with people, and people start to, your feet are smelly, your feet are smelly, then you may need to find ways to keep it dry so that you don't, the germs that cause those smell, especially even armpits, right? Even mouth. And that's why you must, it's even good that you can, because I know it's normal when you wear shoes daily on that smell. Yeah, so that's the moisture. That's what I'm talking about. So if it's not everybody, if you wear socks so that's why it's hygiene. Like I mentioned, it's an hygiene issue. If you wear your socks and your socks are there for a very long time, it gets moist. The bacteria that produces those smell feast on that, and then you start to have those smells. So you don't want that, because it becomes a social issue. You now get to a house, you now say, please remove your shoe. You now start to ask, this shoe, I should remove it. So you need to find ways to keep your feet dry, change your socks periodically, so that you don't become, it doesn't become a social issue and affect your social acceptability, right? Great. Next question, please. Let's have 3 more questions, and then we can wrap up. What are some important tests or screening I should do on a regular basis? Yeah, fantastic. So it's the beginning of the year. Would advise that as many people as possible should go for health checks. And depending on your age, different checks are recommended based on what you are susceptible to. So a 15-year-old young woman should not go for a pap smear, right? Because that's not something that is recommended. We don't expect that to be a problem. But of course, for everybody, especially middle age to elderly, for about 40 people, everybody should know their numbers, right? Like we say, your blood pressure, your blood sugar, and if you have family history of some things, you should screen for those things. So if you have an uncle, an auntie that had a cancer or stuff like that, then if somebody from the family died of breast cancer, your auntie, your mom, then you need to keep an eye and screen and check regularly, do a mammogram for that. Your dad died of prostate cancer, then you need to add PSA, or your uncle, or somebody, or even if nobody even died, but you just we advise men to over 40, do a PSA. And prostate cancer is slowly growing, so you don't even need to do it every year. There are tests you don't need to do every year. If you have done a pap smear 1 year and it says you are fine, you don't need to do it again the next year, because you are fine. Those things grow slowly over time. So you work with your physician and then check. But certainly our blood pressures, our blood sugar, cholesterol, liver function, kidney function, and the whole gamut, based on your age and your susceptibility, they should be part of an annual screening program, and your doctor will check that. Do you do checkup in your hospital? Not. We run checkup programs. Our organization runs checkup programs, community screening programs, and we have a few individuals that sometimes come in, and so you can reach out to us, to the company, and then they can see what you need, and then probably point you. If you have a primary caregiver, I think that we are more in tune with groups of people, treating groups, than individuals, right? That's more what we do more of. Although we do sometimes periodically individuals, but we work with other agencies to make sure that people get the test that they need done as individuals. But we run mass screening programs, hepatitis B, for for BP checks, blood sugar checks, kidney checks. We do that more on a group, company-wide, community-wide, and then we do it. But we are more of community in our organization. Okay, next question, please. Thank you, thank you, thank you for your inquiries. Thank you. Right? How can I permanently get rid of eczema that keeps coming back after treatment. Wow, that's the bane of. So let me first say that there are many things people call eczema, right? So many things, different things. I won't bother to start to, but the funny thing about skin infections, right, especially even if they be truly eczema, what we call eczema, is that they can be difficult to get rid of. But help is not, is for you to find out what some people call eczema. It may just be a simple fungal infection, right? And this fungal infection, if you treat it properly, it will go away. And it can stay away. There can be a chance of reinfection, but you can treat it for. And then if it's an eczema, it's an inflammatory process. Some people may call psoriasis and eczema. It's not. It's different, totally different condition. So if I think the first thing first is for you to first get the proper diagnosis of what is troubling your skin, and then the management option for managing that. Is it ringworm? Is it fungal? Is it bacteria? Whatever it is, so that it can be treated and it can be treated appropriately, right? So let's get a diagnosis and then the proper treatment for whatever it is that is troubling you can be taken. Okay, fantastic. I think we spent 30 minutes. If our audience, anybody from the audience, not banked questions now, if anybody from the audience has any question, let's take that question. And if not, I think we can call it a day now until next week when we come our way again, right? Any question? Any question? Okay. In the absence of any question, thank you so much for taking time to join us today. Until next week, Friday, by the grace of God. Make you remember, say, life, you don't get duplicate. God bless you.